Hi, welcome to another episode of Coffee with Vince. Welcome. Oh my goodness. We are here finally, 2021. That 2020 is behind us and let's move forward to 2021. Here we go. Yes, we're so excited. Hopefully this year is good for everyone, for all of us, and let's not look back to what happened last year. Let's just go forward, look ahead, and hoping that things will be better for this year. So, in this episode of Coffee with Vince, we're gonna talk about how to recognize our loved ones that might need help at home. Since during the holidays, sometimes we go out to see our elderly family, loved ones, and sometimes we see that there's some things that are different than before we saw them. So the holidays brings family together. We go and travel long distances. Sometimes we live outside the state and we come to visit our older family members, and there are signs and things that I'm gonna share with you that you probably have seen that have changed since last time you saw your parents, your grandparents, and your older families and friends. So let's dive in and show you some information and what to look out for or what you saw. First thing we're gonna see is denial. So our families and us as a family member, and we're taking care of someone or seeing our parents or grandparents that they might need help. First step is denial. So they will deny that they are going to need help. They are very good at hiding the things that might show that they might need help. They are going to show that they are independent and they are still capable of taking care of themselves. So the signs of things that you are going to watch out for are as follows. So first sign you are going to see is mobility problems. Every 11 seconds, there is someone in the elderly population that is treated in the emergency room for fall-related injuries. That's 11 seconds. So the first thing you're gonna see is mobility problems or mobility decline. The parent or your grandparent or your parents might not let you know that they have fallen in the past few months or after last time you saw them, because they will deny this. You just have to see what the signs and symptoms that you've seen that is different from last time you saw them. For example, if they are using a cane or a walker now, that compared to before you saw them, that could be a sign of mobility decrease. And then if you see that they're walking slower than usual, they're going up and down the stairs slower than last time you saw them, that could be a sign of mobility decrease. So that's the sign of they might need some help. So statistics shows that when a person falls or have fallen in the past, 2 out of 3 of those might fall again in the next 6 months. And then once they fall, they might increase their risk for falls significantly, because the more they fall, the more mobility decrease will happen. Consult with a home care company that does fall prevention program. Caregivers does implement fall prevention program, and we go through the checklist on the things that they can do to prevent further falls and further visits to the emergency room. So this is one of the things that you can talk to your senior advisors or home care companies if they can implement fall prevention programs for you. You can ask them if they have a fall prevention program. You can definitely call my office, and I can go through over our fall prevention program and how that works for your loved ones. All right, on to the second sign. Second sign, medication errors. So you will see that there's gonna be a little bit of disorganization of medications. Go through their medication cabinets and go through their medications and see if there is some inactive medications that are combined or stored with the active medications. You'll see different medications that are all over the place, and you'll see some medications that are expired and is still there. They should be using somewhat of a medication organization box, like a medication pill box, and that way there is some kind of organization and when to take medications and things like that. The medication pill box will let them know when to take certain medications or if they miss some medications. And then if you see there's some medications left in the medication pill box, that could be a sign that they might need some help, to remind them with medications and when to take them and help them organize a medication pill box for them. So that's one thing to look for is if they have some medication discrepancies or they've missed some medications. All right, talk to them about medications. Third sign, food. So you'll see if they are having a hard time preparing their own food. The fridge is the number one indicator of that. Also the pantry or the cupboard or where they put their food. So if you see some food in the fridge that are old and it's been there for a while, they're not really preparing the usual food, and they're not cooking, and the nourishment that they're getting is not as good as before. Or if you see that they used to cook certain things but now they're not, that could be a sign that they're having a hard time preparing their meals. It could be taxing and a lot of effort to prepare food, especially the ones that they prepare with more time, and if there's more attention to detail on the certain foods that they used to cook and now they're not making it anymore, and they're just doing like sandwiches or something like microwavable food. There's a certain difference on before and after you've seen them. So watch out for those and look inside the fridge and see what kinds of foods that they have, and if they have some old food, expired food, and that could be a sign that they might need some help. Poor hygiene, that is a red flag. When you see someone that is not taking care of themselves, they're not showering, they're not changing their clothes, shaving, brushing their teeth, they're not cutting their hair, or they're just not taking care of the body, that could be a sign that they might need some help. Most people, if they are able to take care of their body, that usually is okay. They just need help around the house. So for them to not take care of themselves, that is a huge sign that they are not able to take care of the environment as well. So when you see them and they don't look as fresh as before, that is another sign that you probably have to ask them if they need help at home. Next one is driving problems. When you see that they are not going out as much as before, they're not driving as much as before, that could be a sign that they might have some fear on driving, or they can't see, or they can't judge the cars, how fast the cars are going. And if they're not driving, they're not going out to the grocery store, they're just stuck at home. Here in Chicago, the Chicago area, winter gets brutal, and when the cold hits and the snow, driving is very treacherous, and it could be very hard for the seniors to go out and get their groceries and medications. If they can't go out and get their medications and their food, they'll be at home, and there could be months where the snow doesn't break, or the cold weather doesn't break. So check on them once in a while, and this is probably the time that you talk about getting them help. Next sign is wandering. So when the senior starts to wander off and gets lost a lot, that could be a sign of dementia. So with a lot of wandering and a lot of getting lost, and if they are not able to come back to their own home, or they're just walking around the neighborhood and they don't know how to get back home, or they don't know how to get to certain places where they used to go, like example, the grocery stores and the pharmacy and their friends, and where they used to go for socialization and things like that, and now they're not able to get there, or they don't know how to get there, they don't know the directions how to get there. That could be the first sign of dementia. And when seniors start to have dementia, the safety aspect of them being alone and not having help, that could be detrimental. So talk to them and see if there's something they can do, or you can do for them. So when they are not driving, usually what happens is they don't go out to places anymore, obviously, because they're not driving, and they stop visiting friends or families, and they start to isolate themselves. Isolation is another sign that they might need some help or companion at home. If they stop going out to their social activities, and right now with the lockdowns, we are probably seeing, hopefully you're seeing them over the video calls or something like that. And then if you see that they are not jumping onto the video calls or conference calls with you guys, try to see if they are isolating themselves, and they're probably going into some kind of a depression because nobody's seeing them. And talk to them and see what else you can do for them and to cheer them up. So what do you do, or how do you talk to your parents or grandparents about getting some help at home, getting some home care set up for them? Because this is something that they don't want to get into. A lot of our families that come out to us, they usually have this concern on how to open up to their parents or grandparents, and when they see that their parents or grandparents might need help. First step is list down or write down the things that concerns you, and then avoid vague comments. Don't come out and say right away that I think you might need help, or I think you need help. They usually don't like that. Try to be on the positive side. Like for example, when they stop going out and when they stop driving, just say something like, I've noticed that you've been staying at home more than usual. What if we can set up something that the home care agency or a caregiver can take you out to see your friends, or to take you out to the grocery stores or something like that. They can help you out, for start maybe 2 times a week or 3 times a week or something like that. They help you out with the daily activities at home, and maybe activities of daily living, which is taking care of the body itself. So when talking to your parents or grandparents about getting care set up for them at home, be patient. Don't rush into things. Try to see if there's you can start the scheduling or introduce the care slowly or shorter hours. They don't like abrupt change in their lives. They feel like they're losing some independence when they are thinking about getting some help at home. So maybe a few times a few days a week, getting some things organized and medication management and the fall prevention program, the exercise program, and getting them out to the communities when things open up, maybe, and companion. Companion is a good thing. It prevents further depression. When seniors get isolated, they become very depressed, and the more they are isolated, the more depressed they are. So talk to them and try to see if you can have a consultation with the home care company. We do offer a free in-home consultation and run the scenario with the family and with the patients, and see what are the areas that we need to focus on and create a care plan according to that. So it's been a pleasure, and thank you so much for watching my video and my episode with Coffee with Vince. Change my cup to a different cup, but take care and see you next time. Bye bye.